Really, I would say some new technology coming out. Where's the Apple Watch going to stand? Is that going to be a new replacement for all these wearables? Because that has a lot of technology built into it to do a lot of associated things. We have Google, who's even exploring contact lens that can measure glucose levels. I mean, imagine that. We talk about for diabetes management, test your sugar so many times a day. Well, what are we going to do when we can measure data all the time? And this is going to have to be a question that we're going to really consider is what do we do when you always have data 24/7 for a disease state and we never really built that into our assessment and plan of how to interpret it. This may be a new area that we never really considered in the practice of pharmacy or healthcare overall, and I think there's going to be some huge ramifications coming from this. Other things I've seen is there was this great study done out in Australia where they were using basically a phone, and there was an FDA-regulated device, and what it is a one-lead EKG. So you could take it, and it's a plate that goes on the back. You would hold it like this, and it would actually tell you what is your rhythm. And what pharmacists were doing out in these community pharmacies is they had patients came in, they were screening them, and they would find patients that had atrial fibrillation that never knew they had it. And because of this, they could then send them for follow-up, see their physician, and hopefully prevent some kind of event from occurring. And it's done so cheaply. You don't have to have a patient go into a clinic that gets attached to a 12 lead. They can do it there. I mean, just imagine with your phone, it's scalability, the ability to reach more people than you ever could in the past, and for perhaps a cheaper amount.